Hi, my name is Stephanie Haywood, and I'm here with my good friend and colleague, Lauren Dominik, and we're the Contracting Gals. We work with Meditract, which is a division of Tract Manager Holdings. Meditract supports full contract lifecycle compliance within healthcare organizations. We also work with our sister company, MD Byline, which provides strategic sourcing solutions throughout the healthcare industry. Together, these two divisions work with hospitals across the country to provide full contract lifecycle and strategic sourcing solutions. We're going to start with a series of 5 contract management topics where we're going to discuss the importance of contract management, the challenges that healthcare organizations face, how to address those challenges, the solutions that Meditract provides to address them, and ongoing oversight and monitoring of your agreements once you have those processes in place. So again, this is the first of 5, and as I mentioned, we're going to start by talking about the importance of contract compliance. Lauren, I know you have a lot of experience in this area. Thanks for sitting down with us and talking to us. Can you share a little bit of information about why contracting compliance is so important?
Absolutely, Stephanie. Thanks for having me here today and talking about contracts and contract compliance. Oversight is important with hospitals and healthcare systems so that they can make sure that they are keeping their contracts compliant with regulations and regulatory pressures that are present. If they have lack of oversight, this creates challenges and creates complexities within the healthcare system that can be difficult to address. If a hospital has adequate oversight in place, they can help alleviate some of these challenges. If they don't, this creates bigger issues and it creates problems with their processes. Do you want to tell us a little bit about some of those problems that can occur?
Yeah, I mean, certainly when you don't have oversight of your contracts, you open yourself up to, regulatory risk. The importance of contracting compliance is to mitigate those risks so that you are in compliance with not only organizational policies and procedures, but federal regulations as well. There's organizations, Joint Commission, DNV, ensuring that you're compliant with, the standards as laid out by those organizations is really important. And when you don't have that oversight, you certainly, open yourselves up to gaps in the process and areas where you may be missing things. When those surveyors walk in the door, I know you've experienced it before when working with healthcare organizations. How does an organization address it?
When the surveyors come in, if an organization has all of their documentation and audit trails, and it's clear that they've done their diligence in relation to their contracts, regulatory pressures, and also contract conformance, if they can provide accurate information to those surveyors, it's more likely that the surveyor is going to move on to the next hospital a little bit quicker. Whereas if they can see that a hospital does not have all of their documentation in place and an efficient audit trail, they're going to stay and they're going to start looking and digging deeper, and this can actually lead to larger problems.
It really can. I mean, not having that ability to provide to the surveyors that information when they're asking for it certainly opens yourself up to more risks, and they start digging deeper. It creates pressures and burdens within an organization when really you need to be able to put your focus back on patient care. But instead, you're concerned about, do I have compliant contracting processes in place? Am I doing everything to show my mitigation of risk so that I'm conforming with those standards? I mean, all those standards are laid out so that an organization can provide the best level of patient care. But it shouldn't be burdensome. So you need a system and a solution in place that supports that full contract life cycle management so that you are minimizing those risks of noncompliance. So when you're working with the health system and you have a surveyor come in the door and you're overseeing your process and you see that there are gaps or that there's areas that you might get into some trouble or have some challenges, what do you do? How do you address that?
Well, that's actually a great question, Stephanie. I'm glad you asked that because that's going to be the topic of our next segment. So today we discuss the importance of contract management and contract conformance. In our next segment, we're actually going to talk about some of the challenges that real hospitals and health systems face and live and breathe every day. So thank you for joining us today. Once again, we're the Contract Gals, and we look forward to speaking with you next time.
Bye.